Good evening and welcome to Faisley Studios here in the heart of Birmingham.
At an NHS local event debating the future for the health service, Chair of the Royal College of General Practitioners, Professor Steve Field, talks about how GPs and primary clinicians could do more, providing care closer to home and delivering more efficient, cost-effective services.
What we have to do is really look at how we move resources and care closer to patients. We have excellent general practice largely across the whole of the United Kingdom. We should be designing services for the patient. We have too many hospitals and we have too much activity going on in hospital. Let's try and keep people out of hospital.
But in practice, how might this work? What would it mean to a typical suburban practice like Park Leys in Coventry?
General practice is at a crossroads right now. In general practice, we have got lots of doctors who are now working as GPs who have got tremendous experience of having worked in the hospital, along with the GPs who actually started off as GPs. Right? What's happened? What's got you in?
Well, I had a cyst in the back of my ear.
So there's scope for really moving a large portion of the work, which is, essentially being done in the outpatients department or is being done, one can call in the hospital as low-level work, to shift it over here, because it's a low-level work that actually forms the bulk of the need of the patients.
I think that the difficulties are that if we're going to transfer services from secondary care to primary care, then the resources have got to go with that to do that work. Certainly I've been a GP here for 20 years, and the amount of work we now do that the hospital used to do is vast. And that hasn't been resourced financially. We've just absorbed that basically. And the feeling around that is that it can't go on forever. And I guess that there's other areas where that is going to become more and more important to change fundamentally how we work to create more capacity. But in a lot of areas it will need more resource.
Resource means both cash and management support. And with the recent health white paper boosting GPs' role in healthcare, new business skills will be needed to deliver the new approaches.
The partners themselves took the decision before recruiting me that we had to start looking upon general practice as a business as well as a service.
How can I help you? How can I help you?
So my expertise and experience is not within the NHS, it comes from industry. And my approach and the way I look at things is different to a traditional practice manager.
It's important that we do run the practice well as a business, because I think it's important to keep the partners happy, and I think it's important for retention of partners and also attracting good new partners to the practice that we do have a thriving business model. And equally important, it's vital that we keep the staff happy.
So doctors at Park Leys have had to become more business focused. But for some GPs, this culture change will be challenging.
And it's a difficult change for the doctors because they spent years at university because they were caring people and they wanted to help people and they wanted to be doctors. They didn't ask to be businessmen, but effectively they've been thrown in at the deep end and said, you're the director of a business, run it.
As the transitional period in the wake of the white paper begins and GPs start planning taking on commissioning responsibilities, opportunities for them to play a bigger role in the delivery of care are up for grabs.
In terms of the next 5 years, clearly we're going to be given more responsibility for budgets. How much of that individual practices take, I'm not quite sure, but I'm sure we will have to be more accountable for the way we spend money, and with that brings some pressure. But equally, I think in some ways it's a good thing that we look at how we spend money and we spend it as prudently as possible, because if we can save money and put it elsewhere in the NHS, that's got to be good for everybody.